Hello class, and welcome to week 5 or the week 4 summary review lecture. I'm excited to be with y'all. I know this is a little bit different entering into week 5 and not being completely done with the class. So we still have, 9 more weeks after this, and I'm sure that it's going to be a fun ride, but I know that this week in particular is going to be the mark of difference, as this is definitely much longer than you've ever spent in a course. So we're going to just jump right into things. Of course, this week we didn't have our group discussion board, and that's just fine. We still have a lot that we can talk about, but this video is going to be a little bit shorter, so hopefully that should help as y'all enter into week 5 also. Really quickly, I wanted to talk about a concept, or two concepts rather, called process and content. And the reason that we're going to start with this is because what we're going to talk about during this video is really kind of that observation, assessment, opening communication that we've been talking about in class. And process and content are both very important in that opening assessment and observation. We talk about this a lot in our the marriage and family class that I teach, so we'll go over it now, and we'll get into it as y'all enter into that class also. Really quickly, process and content, two different things that you're going to be looking for as you are interviewing, or rather, assessing, and kind of those opening questions and sessions with your client. Content is what is said, what is verbally communicated. It's usually going to be straightforward. These are things that you're looking for in the client's story, facts that they're sharing with you. Usually you don't have to do a lot of digging to find the content of what your client is saying. The process is how they got there, how your client got to believing a certain way, acting a certain way, family values, personal values, things like that. This is usually a little bit more hidden, and this is what you are going to be searching for, especially in some of those opening sessions. While they're ready to share information about themselves, which is the content, they're not always even aware of what their process is, and that's part of our job as a therapist, is to really help them arrive at that. So in talking about opening communication, observation, let's talk about the first couple sessions in particular. First of all, I like to tell this to clients also, but therapy starts the moment that y'all walk into the therapist's office. This is everything from the environment that you create to how you present yourself as a therapist to what they're telling you in that first session. It's important to create an environment that feels very calming and feels very safe and at peace. And later on in this class, I'm actually going to take you through a tour of my office. Not that it's anything great or the end all of what an office should be, but my office is specifically designed aesthetically with sights, smells, sounds, in order to make it a place that feels very calming and very safe for the client. This is essentially an escape from their everyday lives. And so when they enter into their room, into my office or my room, that I do therapy in, I want them to feel as if they are kind of escaping from the rest of the world and being able to come and just be themselves in that space. So we'll take a tour of my office at some point, but just know that the environment that you create is part of the therapeutic process. Also, you as the therapist are part of the therapeutic process. Not only the wisdom and knowledge that you bring to the room and your professionalism and your expertise of the counseling process, but who you are as an individual, and the peace and the safety and the calmness that you invite the clients to join you in is also very much a part of the healing process. And this is present from the moment that the client walks into your room. I know I keep saying room, but I mean office, but room sounds a little bit less formal or less not professional, but sometimes when people come to an office, it feels very formal. So that's why sometimes I use the word room. So again, therapy starts the moment that the client walks through the door. Now, the first couple sessions really are a lot of information gathering. This is a time that you are going to be asking them about themselves, that they're going to be sharing information so that you can make a good assessment of the direction that treatment needs to head and give yourself ample information so that you can know which strategies, interventions, and theories that you would like to use with that specific client. Of course, there's always room to tweak and to change within the therapeutic process, but some of these opening sessions are really what kind of sheds light on what the client needs and also how you can best approach them. Remember that this is not a sprint, but rather a marathon. So a lot of times people will view the first session as very similar to a doctor's appointment, where the client comes in or the patient comes in, they give you their story, and you make a diagnosis on the spot and you prescribe something. That's what doctors do. We are a completely different profession, and that we're offering them space to come on a regular basis and to share their stories with us, not as a quick fix like sometimes a medicine or a prescription will allow you, but as a lasting healing process. And so in that, it's very much that marathon feel. And it's okay in that to take time to be thorough. A lot of times there's this pressure that you might feel that within the first session or so, you have to create this airtight treatment plan and have a really good sense of where the client is wanting to go and what they're needing. But I think what's really important to remember is that the client isn't going to be able to share all of their life with us in a 50-minute session that first time. And it's okay to spend additional sessions digging for information. This is going to be something that comes out through the whole therapeutic process, is that digging for information. Gathering information does not have to be like a job interview or grilling somebody or interviewing somebody in order to get all the answers to your questions met. Last week, we talked a little bit about how our brain receives communication and questions. We have the three different brains, or three different portions of the brain. The bottom two that are always scanning for danger and always figuring out what should I do with that danger that's coming into my world. And one of the things that we highlighted was that questions can oftentimes feel like a danger because you're looking to find the correct answer. And sometimes in trying to find the correct answer, you feel a little bit threatened. Those guards might go up, and the person may or may not feel that they are able to be safe within the room again. So as we're going through the assessment process, it's also very important to, while you're gathering information, also watch the ways that you not only phrase questions, but check to see if maybe you can make them a statement instead, inviting the client to continue to bring more of their story into the process. So for instance, if you need further clarification, rather than saying, well, what do you mean by that? Ask the client, instead of could you, say, tell me more about this, and go back to that subject that you're looking to know more about. This opens the door for them to feel safe, that there's nothing that you're finding wrong with their story, but they are free to then share or continue to share what they feel comfortable with. So, of course, we're remembering that a client has more of a story than they can share in the first session. And this is for multiple reasons. There's that logistical factor of going, we have 50 minutes, and it's very difficult to unpack 20, 30, 60 years of somebody's story in simply 50 minutes. But the other, even more important part that I found is that it's very intimidating as a client to walk in and to feel like you can share every part of your story with a complete stranger. And so part of the therapeutic process is developing that therapeutic alliance or that therapeutic relationship so that as the client continues to come to counseling, that they are able to feel safer to continue to dig deeper into their issues and share their story with you. And I wanted to share a brief example with you. This is a friend of mine who's a therapist. We are in licensure supervision together, and so sometimes we staff cases and just get feedback and learn and those sorts of things. And so this friend of mine was staffing a case of a young woman that she was seeing, and the young woman came in and came in for some family of origin issues, some attachment, and and some anxiety. Those were kind of her presenting issues. And so they started doing some work, and about 3 or 4 sessions in, kind of towards the end of the session, my friend's client looks at her and says, well, I just want to let you know that I now feel safe enough to share with you that I think I have some sort of an issue with my sexuality and how I display that. So my friend asked her to share more, and in the course of those couple of minutes, her client shared with her that she had gotten into several sexual relationships that were not necessarily safe. Well, this, of course, took my friend aback because this was brand new information. It was at the end of the session, but it was definitely, something that they could include into their treatment process. But what came out of that even more was that it really took the client 3 or 4 times of meeting to be able to share that sort of sensitive information, which was really the reason that she was coming to counseling anyways. And so when those things happen, of course, it's not our job to shame the client or to ask them why they didn't tell us that sooner. We need to recognize that they are sharing information with us at the pace that they feel is safe. And so anytime that they kind of take the lid off and decide that they want to share more information with us, it's our job then to welcome that into the room and recognize that this is going to be a valuable part of the counseling process. So the last piece, kind of in that opening, assessment, communication, those sorts of things, is really making sure that you are affirming the courage that it takes in order for your client to share their story. This is something that's going to be very, very important. This is something I try to share with all of my clients after the first session for sure, and just letting them know how much courage it takes to come and share their story with a complete stranger. I always want to leave them on that note, knowing that I know how hard that is and how proud I am for them for reaching out and for being courageous and sharing that in an effort to better their lives. So that's something else that you can offer to your client.